Right, this section will look at adrenal glands, and so we'll look at hormones that are made from cholesterol, or commonly known as our corticosteroids. The adrenal glands are found on top of both kidneys, and so they consist of an outer adrenal cortex and an inner adrenal medulla. And the function is what separates the glands. The adrenal medulla, like what we have here, is neural tissue, and it secretes epinephrine, so epinephrine, and norepinephrine in response to sympathetic nervous system stimulation. The adrenal cortex, which what we have here, is a glandular epithelium, and it secretes steroid hormones in response to adrenal corticotropic hormone, or ACTH. And so within that, what we find are three different layers of the adrenal cortex, which are the zona glomerulosa, the zona fasciculata, and the zona reticularis, all of which will produce their own hormone that are important for some type of regulation. The hormones within the adrenal cortex all come from synthesis from cholesterol, and so these are termed as cortical steroids or corticoids. Both are used interchangeably. So there are three main different categories of the types of cortical steroids that are produced, and it depends on the layer in which they are produced in. So mineral corticoids are produced within the zona glomerulosa of the adrenal cortex, and so they're important for regulating sodium and potassium balance. And so a good example of this is aldosterone. Glucocorticoids are produced within the zona fasciculata, and these are important for metabolism of glucose. And so cortisol, our stress hormone, commonly referred to as, is an example of that. And then lastly, adrenal androgens are produced within the zona reticularis of the adrenal cortex that are weak sex hormones that help to supplement those within the gonads, such as testosterone and estrogen. But an example of that is DHEA, or dehydroepiandrosterone. And so these are going to be precursors that help to make those stronger androgens that we have within the gonads. The adrenal medulla is a modified part of the sympathetic nervous system, and so it's going to be the primary stimulus for increasing the secretion activation of the sympathetic nervous system, typically due to stress. And so they have effects similar to that of sympathetic innervation. However, these hormones will last in circulation 10 times longer than that of just having sympathetic innervation. And so what happens is that there's a release of epinephrine and norepinephrine, and so this is going to be secreted into the blood by exocytosis, and their affinities will vary depending on what their target tissues are and what receptors they have. So epinephrine, this will reinforce the sympathetic system in mounting that fight or flight response that we have in those stressful situations, and also helps to maintain arterial blood pressure and increase blood glucose levels and blood fatty acid levels. Some other effects that both these hormones have too are an increase in cardiac output, increase in respiratory rate, and mental alertness, and it helps to dilate coronary blood vessels to get more oxygen for the heart, and then also elevates the metabolic rates. In relation to the hormones of the adrenal medulla, we should talk about the stress response and what happens. And so these are going to be patterns of reactions to a situation that is going to threaten homeostasis. And so if we look at this figure here, so when we're in stressful situations, what happens is that that is going to influence the hypothalamus, okay? So the hypothalamus is going to release cortical tropin-releasing hormone, or CRH, which is a stress hormone, and that's going to activate then the general adaptation syndrome, all right? And so this will then influence the anterior pituitary gland then to secrete amounts of adrenocorticotropic hormone that will then further increase the amount of hormone that's produced within the adrenal cortex to make cortisol. And so this will continue until we have high levels of cortisol circulating within the bloodstream, and then that will start to inhibit either the anterior pituitary gland or it will inhibit then the hypothalamus. So some problems that can occur is when we have chronic stress, because this leads to an increased risk for illness. However, in the short term, this is good for recovery, such as an illness or trauma, and cortisol helps inhibit the immune system so it does not over-respond. But in chronic stressful situations, that is combated. And so cortisol may act on higher brain regions then and contribute to depression and anxiety and then a loss in memory. And also some of the other side effects are stimulation of the liver to release glucose, and then insulin receptors then start to become resistant, making it harder to treat people with diabetes. So some of the stages of the general adaptation syndrome to stress include an alarm reaction, where this is going to start activating the adrenal glands to start producing those hormones. Then we'll get into a stage of resistance where we have to readjust in response to these high stressful levels, and so sometimes it might take us a while to calm back down. And then also stages of exhaustion, where chronic stress tends to lead to a large bout of exhaustion. And in long term, this can lead to severe sickness and or death. And so some of the effects then will be to, with the activation of the adrenal glands, is that increases the growth of them. Also, there's going to be atrophy of the lymphatic tissue, where we have the immune system decreasing and dying off. And then also formation of peptic ulcers, which are due to an increase in those sympathetic hormones that are circulating through our bloodstream. And so when we look at the negative feedback under just acute situations of stress, so if we respond to some type of non-specific stressful situation, that's going to activate higher brain centers. And then the sensor, integrator, and effector are all going to be the hypothalamus. So the hypothalamus then is going to increase the amount of corticotropin releasing hormone, which is then going to influence the anterior pituitary gland to increase the amount of adrenal corticotropic hormone to be produced, which is then going to affect the adrenal cortex to increase cortisol levels, where cortisol then is going to start degrading proteins, also stimulate gluconeogenesis and inhibit glucose utilization to help increase blood glucose levels, and then also stimulating lipolysis, breakdown of fats. And so in the negative feedback, this will continue until that has an effect on the hypothalamus, or it's going to inhibit then the anterior pituitary gland from continuing release of either ACTH or of CRH.